Hello and welcome to my channel. I am Dr. Udaykumar. Welcome to my clinic, Life Care Clinic, where we deal with all the infectious disease cases. Today, we are going to be learning on a very important daily required topic, that is medical records. So, a lot of people may think, why do we have to deal with medical records? But if you see the medical legal value, then definitely medical records is a must. We definitely see patients, and after seeing them, we think that we have did our duty. But as we know, we are under the jurisdiction of medical legal issues. We can face problems in the future. So, what are medical records? Medical records are a very important form of medical legal documents, and they reflect the treatment given to the patient whether on an outdoor patient or an indoor basis, and they do not emphasize that the medical record, if incomplete and inaccurate, does not help in the long run. The medical records which are required to be retrieved often therefore should be stored properly. So we should have all the legal issues done in a proper way so that we can address them in the future. So does really the medical legal issues was there any issues in the past? Yes, the Bombay High Court in the case with the Raghunath Raheja and Maharashtra Medical Council, they held the patient or the legal representative, they required the photocopies of medical records and the doctor could not supply them. Therefore, High Court held a reasonable cost. High Court says that this should be given to the person, and the reasonable cost for photocopying that should be recovered from the person. So that was the case that was there, and therefore we need to have all the medical records in the right tissues. Now, what does MCI, the Medical Council of India, tells us? By the 2002 Regulation Act, it is required that if the supply of copies of medical records from a patient or her legal representative, the doctor has to provide the medical report within 72 hours of such request. So, if the doctor fails to comply with the request, then the concerned doctor can be held liable for professional misconduct. And all this is given in the following. So, we should always be there to maintain the medical records, and every physician shall maintain the medical records pertaining to her indoor patient for a period of 3 years from the date of commencement of treatment in a standard pro forma laid down by the Medical Council of India. So these are the things we should be aware of, and if we are aware, we can deal with the issues in the proper direction. So what is a medical record? Medical record is a document in which we enter all the detail. So it should be dated and signed, and name of the concerned person should also be there available on that particular record. Now, suppose the person has given a false name or has given incorrect name, then there is no change in the correction of the name. So any person giving a data or documentation, he should provide with the legal name and legal address. Now, if this request is made for medical records either by the patient or authorized attendant or legal authorities involved, the same may be duly acknowledged, and document shall be issued within the period of 72 hours. So 72 hours or 3 days is the time in which we should be provided with the record. Now, a registered medical practitioner shall maintain a register of medical certificates giving full details of certificates issued, enter the identification marks of the patient, and keep a copy of certificates. She shall not omit to record the signature and or thumb impression, address, and at least one identification mark of the patient on the medical certificates or reports. So this is very important. We should take a signature or thumb impression on that record so that we understand that this was given by the patient himself. Again, the effort shall be made to computerize the medical records for quick retrieval. That is something we are going in the future. We now rely more on the data, and since this is data driven economy or period, we require a lot of issues that can be addressed in a better way. Now, what about the HIV/AIDS patient? Since we deal about the HIV/AIDS patient, do we have any kind of Special issues that can be maintained for this. Yes, HIV/AIDS patient, as we know, we need all kind of secrecy, and since the stigma involved, HIV/AIDS patient, the medical records of this patient should not be released to third parties, or they should be released only on proper authorization by the patient or his legal representatives. Unauthorized release of medical record can amount to breach of right of confidentiality of the patient. So this becomes a bigger issue, and therefore we should be very much aware of this particular thing. Now, as we know, there is medical photography, the thing that has been done most commonly, and this medical photography when done, there we always need to learn more things. So we share cases or knowledge when what we learn from one patient that can be delivered to other patient. But in this particular thing, while doing some interesting cases, photograph of patient are taken, then we should have a proper medical record of the patient, and photograph when taken, it should be published in such a manner that the identity of the patient should not be revealed in any manner. The consent of the patient should be taken, in which it should be mentioned that the photograph can be used by the medical person for medical knowledge or enhancement of the knowledge, and that should be also maintained in the particular photograph. The Medical Council of India also provides the issue ethics and regulation terms, and in which we have to issue the photograph of patient, we should hide the identity by blanking the eyes of the patient or otherwise. Now, when such kind of photos are taken, a registered medical practitioner shall not publish photograph or case report of his or her patient without their permission in any medical or other journal in a manner by which the identity could be made out. If the identity is not to be disclosed, the consent is not. How and where we should maintain the OPD paper. So maintenance OPD paper is one of the big thing. Generally, we consultants do not maintain OPD papers of the patient. This is either due to lack of time. Therefore, in case of litigation, allegation, or medical negligence by patient, then we are on a list. So who has been seen purely on OPD basis, the patient doctor lands in difficult position. Therefore, it is always ideal to maintain the copies of the OPD papers. If a complaint is filed, in a complaint filed before the Kasargod district forum, this issue was raised. Patient alleged that she was prescribed the tablet Septran by her family physician. Subsequently, she developed Stevens-Johnson syndrome, which while she was also taking treatment for vitamin B deficiency. When a specialist opinion was taken, the diagnosis was made. One of the allegations is drugged without performing necessary tests, and therefore she developed a drug reaction. However, she had not put on record before the district forum the prescription of doctor advising tablet Septran, and therefore the complaint was dismissed. The patient preferred an appeal from the Kerala State Commission, who upheld the dismissal in the following words: as has been this the best piece of evidence to establish as to what are the drugs prescribed by the opposite party in the prescription, the prescription was not produced. There is no independent evidence of attending circumstance to support the case of the complaint in that regard. In evaluating the evidence in this regard, it's important to bear in mind that burden of proof to establish negligence is on the complainant. Hence, anything what you take, you should always have a prescription. You should check the prescription of the drugs that has been given to you, and then consider the treatment. So, when there was the best evidence in the position of the complainant, unless the complainant produces the same, the complainant will not be able to establish her case. He is a physician. Within the span of 2 years, he might have treated several patients. In such circumstances, one cannot expect that the physician should remember all the medicines he has prescribed. And anybody who has allergic conditions for sulfur drugs or otherwise, should maintain or should have a diary or a ticket in which everything is mentioned, so that the treating doctor might refer or might give away from other medicines. So in this instant case, an adverse reaction inference was drawn against the complainant, that patient of not producing the best evidence in a position, namely the OPD papers. So as we conclude here, it is very important on the side of the patient that he should have proper documentation, as well as doctor should also maintain records. The important takeaway points from here is medical records be stored for a period of 3 years from the date of commencement of treatment. On request, photocopies of the medical records are required to be supplied to the patient or his legal representatives. Needless to state, supply be made only on proper authorization only. Third, consent of the patient. If photograph of the patient is published, when the identity of the patient is revealed, there should be always maintained. The privacy should be always maintained. So that's all. We should understand these 3 important points. Though simple, very important, and we should know them by heart. And if any issues is there, we can contact on my number. This is my address. And if you like this video, please share the video. And if you like this content, you can like the video as well. Thank you very much. Thank you very much.